The nurse is giving discharge teaching to a client tries 7 days post myocardial infarctions. He asked the nurse why he must wait 6 weeks before having sexual intercourse. What is the best response by the nurse to this question? When you can claim 2 flights of stairs without problem, it is generally safe. Which of the following should the nurse implement to prepare a client for a KUB, kidney ureter bladder radiograph test? No special order are necessary for this examination. The home health nurse visit a male client to provide home care and find the client lethargic and confused. His wife said he fell down the stairs 2 hours ago. The nurse should send him to emergency room for evaluation. A client who has recently been diagnosed with cystic fibrosis is in pediatric clinic where a nurse is performing an assessment. Which later finding of this disease would the nurse not expect to see at this time? Moist productive cough. The nurse is performing a neurological assessment on client post-right CVA. Which finding, if observed by nurse, would warrant immediate attention? Decrease in level of consciousness. The nurse is speaking at a community meeting about personal responsibility for health promotions. A participant asked about chiropractic treatment for illness. What should be the focus of nurse response? Spinal column manipulation. Which of these findings indicate that pump to deliver a basal rate of 10 ml per hour plus PRN for pain breakthrough for morphine drip is not working? The level of drug is 100 ml at 8 am and is 80 ml at noon. When teaching a client with coronary artery disease about nutrition, the nurse should emphasize avoid very heavy meals. An RN who usually works in spinal rehabilitation unit is floated to emergency department. Which of these clients should the charge nurse assign to this RN? An adolescent who has been on pain medication, terminal cancer, with an initial assessment finding pupil and a relaxed respiratory rate of 10. A client come to clinic for treatment of recurrent pelvic inflammatory disease. The nurse recognized that this condition most frequent follow which type of infection? Chlamydia.